Before watching this video, please read down the disclaimer noted in the description. Thank you. Hello everyone. Today we are showing our short demonstrational video of stereotactic frameless navigational biopsy performed in 360 degrees video. You can easily switch to virtual reality mode by clicking on the cardboard icon in the right bottom corner of this video. The first step is registration and non-sterile navigation. During registration, you have to match patient's head with virtual model based on MRI scans, which are downloaded into navigation station. After registration is complete, test matching accuracy by comparing anatomical landmarks on virtual and real head. High accuracy of registration is a goal of non-sterile navigation. If you are not satisfied by registration, restart tracer once again. Registration is complete and we are going straight forward. Now surgeon detecting entry zone for biopsy. You should make biopsy plan before patient is coming to operating room. On the one hand, it will reduce your operating time, and on the other, if there are any issues happens with navigation station, you can figure it out before patient will have general anesthesia. Now during the surgeon working as a barber, let's have a brief look around. Right now, as you can see, everything's set. Sterile navigation frame located exactly in the same position as registrational frame. This is very important not to shift frame rack during scrubbing. Once it is registered, the frame and the patient's head started to be one coordinate system. If your probe started to be invisible for navigation station, ask your assistant to change view angle of navigation infrared cameras. Check all necessary biopsy equipment before making an incision. Remember to fixate biopsy guiding system according to your biopsy plan. Sometimes it could take a while. Before starting an incision, make a small mark on the patient's skull of your borehole placement. For this, take a sharp knitting needle, put it into a biopsy guiding system. Use a small hammer to make a superficial mark on the bone. Okay, right now surgeon already made a skin incision and borehole craniectomy. Dura is cut in X-like shape. If you turn around and look to the anesthesiologist's place, you actually will see some illustration of skin incision, and also you will recognize superficial bone mark which was made by using sharp knitting needle. Using this trick, you can be sure that borehole will be located exactly in trajectory line of your biopsy plan. Here we can see that biopsy needle is inserted and its tip located in the periventricular lesion. To collect tissue pieces, create negative pressure in biopsy needle by the small insulin syringe. Take the biopsy material by turning the needle along its axis, and don't forget to do it in the different depth of the lesion. Right now, surgeon demonstrating us collected samples in the needle. To identify an exact place of tissue samples collection inside the lesion, inject a small amount of air into a biopsy needle by using the same insulin syringe. At the post-op CT scan, it will be well recognizable bubble of air right in the place of your biopsy. Now you see a final stage of biopsy procedure. Next step will be wound stitching in traditional way. You will see neuroimaging data and histological report of this case in the end of the video. And now, just a few afterwards. We hope that neurosurgical residents will find this video useful for educational purposes. Feel free to leave us comments, write down what neurosurgical procedure you want to watch in such panoramic way. In nearest future, we're planning to create stereoscopic video, and we think it will be rather interesting for audience. And of course, we will be grateful if you will support us and subscribe to our channel and leave positive feedbacks.